Hi viewers, and welcome back to another Bestie video. You'll be shocked to know how common diabetes is. 1 in 10 people in the US struggle with this chronic disease. On top of that, 1 in 3 Americans has prediabetes. What's worse is that only 15% of people with this condition know they have it. The rest go undetected. This is why it's even more important to learn about the telltale signs of diabetes. One of them appears on your nail. In today's video, we're going to discuss the appearance of your nails and the signs of diabetes on them. Is it a slight blush to your nails? Could yellow, brittle nails be a sign? What about distinctive lines across your nails? We'll be talking about all of these and more. Diabetes is a deadly disease, especially when you don't even realize you're suffering from it. As diabetes is a silent killer with no obvious symptoms, not many know they have it until they specifically test for it. Your nails turn yellow and brittle. Sometimes your nails can turn yellow. It's probably because of an infection caused by fungus. In very rare cases, the yellow on your nails could be a form of a condition known as yellow nail syndrome. You don't have to worry about the color itself. It's not harmful for your nails or fingers. There's no need for any treatment, but it does point to issues such as diabetes. More often than not, yellow nails usually do mean you have diabetes. This yellowish color is caused by the breakdown of sugar in your body. The breakdown has an effect on the collagen in your nails, which causes the yellow color. Shortened nails. Some of us have the habit of biting our nails a lot. If you're always biting your nails, they're going to be shorter. There would even be breakage because of the constant biting. If you don't bite your nails and just still see breakage, it could be an indication of health-related issues. One issue is nerve damage. While this is rare, the damage is usually because of diabetes. Diabetes-related nerve damage also puts a stop to nail growth. Your fingernails will also look fragile, almost as if they've been shortened. Blush on the nails. If your nails are healthy, they're usually pink in color. The color of your nails also tend to be even. But if you're having health issues such as diabetes, you'll see changes in the color very quickly. The shape of your nails also changes, along with the thickness and consistency. Among these changes, you might see a slight blush on your nails. If it happens, it's definitely a symptom of diabetes. Lines across your nails. Vertical ridges on your nails are a normal occurrence. It's just a consequence of aging. But if you see horizontal ridges, then you might be suffering from type 2 diabetes. These horizontal lines are known as Bow's lines. They occur because your blood sugar levels are out of control. You'll need to take measures to moderate your blood sugar levels and manage your diabetes. Keep in mind, these horizontal lines don't always mean diabetes. You could have other underlying symptoms causing this issue. For example, a thyroid problem can also result in these strange lines across your nails. While these symptoms can be helpful in spotting diabetes, they're not the only signs you need to look out for. There are other telltale signs as well. Let's discuss them one by one. Frequent urination. One of the indications of diabetes is when you start to urinate at a much higher frequency than usual. This happens because of high blood sugar levels in your body. When there are high blood sugar levels, it becomes difficult for your kidneys to process the sugar. If you're not able to do it effectively, a lot of glucose goes to waste. Your body gets rid of this excess glucose in the form of urine. In the beginning, you may not even realize you're urinating far too much. But if you find yourself having to wake up in the middle of the night to rush to the bathroom, it could be a sign of diabetes. You should go get yourself checked by a physician if this happens. Blurry vision. Diabetes can also cause blurry vision. It can be a minor issue that you can fix by taking some eye drops or getting your blood sugar levels stabilized. In some cases, however, it can be a more serious issue. When you have blurry vision, it can be because your glucose levels are not in the right range. If the glucose levels are either higher or lower than the range they're supposed to be in, it could be a sign of diabetes. Insulin treatment can also lead to blurred vision. The treatment shifts the fluids in your eye, which can cause blurry vision. Usually, this gets resolved by itself on its own after a few days. There are long-term effects of retinal disorders due to diabetes, especially diabetic retinopathy. There are 4 different stages of diabetic retinopathy. It's unlikely you'll even be aware of the condition until it reaches stage 4. If you do suffer from diabetic retinopathy, you won't be able to completely cure it. but you can stabilize the blurry vision using treatment. You can also develop cataracts due to diabetes. People at a younger age are more likely to get cataracts. When you do get cataracts, your eye lens becomes cloudy, and you'll have trouble seeing. Glaucoma is another condition you can develop if you have diabetes. People with diabetes have double the risk of getting glaucoma. You'll have reddening of the eyes and you'll lose your peripheral vision. Extreme fatigue. One of the most common symptoms you face when you have diabetes is fatigue. It's not a simple correlation either. The disease itself causes extreme fatigue because of your glucose and blood sugar levels. The fluctuating levels of glucose cause you to get tired. Your body does not get the energy that it needs to function properly. In one study of more than 150 adults with type 2 diabetes, it was seen that glucose levels can indirectly be the reason for fatigue. There are other reasons why you might suffer from fatigue when you have diabetes. It could be because of widespread inflammation or insomnia. You could also be facing low energy levels due to hyperthyroidism and kidney failure. You may also be experiencing lower energy levels due to other factors. People with diabetes may skip meals from time to time. This means you're not getting enough nutrition, which causes a dip in the amount of energy your body can tap into. A lack of physical activity is another common factor for people with diabetes. When you're not staying active, you're going to feel sluggish and gross. Wound healing. If you suffer from a minor injury and the wound does not heal as quickly as it usually does, it's probably a symptom of diabetes. When your blood sugar levels are high, it hampers your body's ability to heal wounds. People with diabetes will also see that their wounds spread too quickly. While you might get cuts and bruises anywhere, diabetic people tend to get injured on their feet. If you suffer an injury on the foot, it'll turn into an ulcer very quickly. If you don't get foot ulcers treated in time, it can become a more serious problem. Experts suggest that at least 15% of people with diabetes also end up with foot ulcers. This is why it's important to always keep track of wounds you suffer. This way, you can reduce any chances of complications. Thickening of skin. Digital sclerosis is another telltale sign of diabetes. This condition makes the skin on the back of your hands look waxy and tight. Over time, your fingers will get stiff so that it'll be hard for them to even move. Never ignore the skin condition. If it goes untreated for long, it'll make your fingertips feel like they have pebbles in them. The hardening of the skin won't stop with just the back of your hands. It'll spread to other parts of your body like your upper arms, forearms, neck, and shoulders. It might even spread to your back. Blisters on your skin. Do you get blisters often? Is it one big blister or a cluster of them? Do they hurt? These are questions you seriously need to ask yourself. Blisters could be a sign that you have diabetes. People who struggle with diabetes usually get blisters on their hands and feet. They may also appear on your legs and forearms. You shouldn't get confused between blisters caused by diabetes and those you get from fungal infections and allergic reactions. The ones caused by diabetes are mostly painless. These kinds of blisters do not cause scarring. If you think you're getting blisters too often, it's time to talk to a doctor. Dark patches. Ever notice dark patches or velvety skin on your neck, armpit, or groin? If yes, you should be concerned. It could be a sign of diabetes. Dark patches indicate there's too much insulin in your body. Your skin could also feel really itchy. You'll find yourself scratching at the worst moments. It might even smell a little funky. The darkening of the skin on the crease of your neck is a huge giveaway that you could be struggling with diabetes. This condition is called acanthosis nigricans. There are a number of subtle signs you need to look out for if you want to catch diabetes early. The earlier you get a hold of it, the easier it could be to treat. Warning signs that appear on your nails aren't the only symptoms of diabetes. There are other surprising symptoms you should know about. Once diabetes is diagnosed, you'll need to pay close attention to your diet. Let's keep the conversation going with a couple more related videos, shall we? Here's what you need to know. Check out the 6 best and 6 worst vegetables for diabetics. You should also watch 16 signs your blood sugar is high and 8 diabetes symptoms. Go ahead, click one, or better yet, watch both and learn more about diabetes and how your diet affects it. Did you know about these warning signs before watching this video? Let us know in the comments below.